So, as you guys know, I'm a clinical counselor in training. Just finishing up my first quarter of my master's degree right now. Next summer, I will be starting to see patients. And I wanted to show you something that I learned this quarter. During our theories class, we have to do a number of case conceptualizations. And that's where we use theories to help patients. So we create this case concept or case study at the beginning of the quarter. And we use that case study for 3 different case conceptualizations where we use the theories we learned in order to help the patient. One of the 3 case conceptualization theories that I used were psychodynamic, which that was actually chosen for me. The second one was CBT, cognitive behavioral therapy. And then the third one that I just used is ACT, acceptance and commitment therapy. Now, I got to do a presentation in that class here in a couple hours. But I wanted to show you one of the exercises I learned from ACT. And this was in a book about ACT for children. And now, even though the book itself is ACT for children, this can really help with, can be used for anyone, really. And this is a snow globe exercise. Let me get a little bit closer here, since my snow globe is kind of small. So imagine all your thoughts, all your negative thoughts that you can't stop thinking about, that are weighing you down, is the glitter in a snow globe. Now, when you're ready, sit in a comfortable position. A lot of times we'll have kids sit on their bottoms with their legs crossed. Take some deep breaths. Just try to relax, okay? Imagine the thoughts, all your negative thoughts, are the glitter that's swirling around in the snow globe. When you're ready, after you take some deep breaths and you're relaxed, just let those thoughts sink to the bottom of your snow globe, to the bottom of your mind. When you shake it up, when you think about those thoughts constantly, you are actively shaking up the snow globe, okay? But if you just sit and not focus on those thoughts and just relax your mind, rest your mind, you let those thoughts sink to the bottom. They're still visible in your mind, but you're no longer focusing on them. You're no longer allowing them to blind you. You can see them, you can experience them, but they are no longer making up the entirety of your mind. That is the snow globe exercise. I really like this exercise. This, along with the 5 senses exercise, which I'll get into maybe in another video, I really kind of attached to listening to the audiobook, which I put on the screen. During my conceptualization for this case study, for this theory, I listened to 2 audiobooks. One was, I forget the first one, but it was just ACT, acceptance, commitment therapy, talking about it and everything. Didn't really go into a whole lot of exercises. And then the second one was ACT for children. And one of the main exercises that it kept bringing up was the snow globe exercise. And though I'm not sure I did it fully the way the author did it, I do still need a little bit of practice. Like I said, I'm still in training. But this was the gist of the exercise. And what therapists have found is that ACT works very well for anxiety. It works well for autistics, and anyone experiencing nervousness or depressing thoughts. It just and without realizing that I was doing the snow globe exercise, I have done this before, where I don't really imagine my thoughts as a snow globe, as the glitter in the snow globe per se, but I do imagine my thoughts just kind of swirling around in my mind, and how I just have to let them settle. I can experience them, I can see them, I can think about them for a certain amount of time, and then I've just got to let them settle. Now, another exercise is to give yourself a set amount of time during the day to think about all the things that are causing you trouble, to think about your worries, think about your problems. But as soon as that time is up, be like the snow globe, okay? Set that time, stir up your thoughts, shake up the snow globe, okay? But then once the time is out, let it settle. So it's just something I wanted to share with you guys. I hope you enjoyed this video. I really like ACT. As a therapist, once I get my license and everything, I do plan on using attachment theory, Adlerian theory, CBT, and ACT together. I think all four of those will really help with the trauma specialization that I intend to do, as well as autism. Now, there is no cure for autism, there's no treatment for autism, but we can help those of us who are autistic better manage our anxieties. And that's where the core trouble that we're experiencing is the anxiety. We don't need to relate better to the world. We don't need to change ourselves in order to fit into the world. We just need to calm our anxiety so that we can better experience the world. So there you go.